Alright, how's it going, everybody? CreekWater Cody back at you from the house again. Just posted my bug out bag video yesterday, and well, response I got, a friend of mine shot me a text asking about the first aid. Something didn't delve too deep into in that one. I kind of showed you guys the kits that I had, the size of them. We're going to go into some contents. Figure this would be helpful, and first aid kind of deserves its own video anyway. First thing, some knowledge. Taken several courses over the years, some basic Red Cross, CPR, life-saving techniques. Took one that was a bit more advanced as far as rescue situations. Been to some state and federal sponsored events, FEMA disaster stuff, Homeland Security, mostly about 72-hour survival, hurricanes, things of that nature. Excuse me. Like I said, the first thing is knowledge. Military field manuals. I got a stack of these on all different topics. This is obviously first aid for soldiers. Get these at any military surplus shop. Buy them online. They're inexpensive but invaluable for the knowledge that's in them. This thing's got everything, diagrams. It's got pictures. It's got the words. It's got, everything. Bandaging, fireman carries, tourniquets, splints, first aid. That's, immediate. Something happens. You're the first one on the scene. You want to get them stable, stop breathing, or stop bleeding. Keep them breathing. Don't stop the breathing. Keep them breathing. Stop the bleeding. Splint any broken bones, anything like that. But then there's a good book, Medicine for Mountaineering. It's by an organization called the Mountaineers. They put this thing out. This is 6th edition. This is a great resource. It goes a little beyond simple first aid, and it actually goes into treatment. This is more of a expedition manual where you're middle of nowhere and you're not exactly getting med flighted out anytime soon. Medicine for Mountaineering, great reference. A couple others I'd recommend would be a classic Grey's Anatomy. A few others, Bell's Manual of Surgical Operations, classic textbook. Getting into some surgery. Once again, that's a little more treatment. Let's see. In your gear, in your toiletries bag, you're gonna want to have some soap, some antibacterial stuff, and some sanitizer. Get into working on somebody that's been cut, burned, which are two of the majors out on the trail. A lot of cuts and scrapes, burns, stings. You get twisted ankles, possibility of broken limbs and whatnot. Those are kind of the most common. But you want to keep it clean, everything sanitized, obviously, keep the germs out. So, good antibacterial soap, environmentally friendly antibacterial soap, and some Germ-X, Purell, some alcohol-based sanitizer. So, in my kit, recommend having, you guys know I love bandanas. Have at least a couple of those. They're good for, you can make a bandage with it if you need to. You could tie a tourniquet with this thing. You could fold it up, make a sling, if you had a broken arm. Same with the paracord. If you need to build a stretcher to get somebody out, you need to tie a tourniquet. There's 1,001 uses for these things when it comes into the first aid and the treatment. Which brings us to my first aid kit. Casing, it's from an Eddie Bauer first aid kit picked up at Target or some such. But the contents are pretty much me. Once again, knowledge. Keep a little first aid basics in here. Just some American Red Cross recommendations. Little instructions. Refreshers never hurt. As I said in my other video, what if I'm the one that's hurt? A little Advil bottle, enough cotton in there where it doesn't shake. I'll put some aspirin in here, maybe some sinus medication. When it comes to medications, you're going to have to meet your needs. I mean, everyone has specific needs. If you have asthma or you're diabetic, whatever the case may be, you're going to have to cater your kit. This is kind of also your medicine cabinet, as well as, you know, your doctor's office. So, you know, keep in mind any personal medications, anything like that, allergens. Let's get a little deeper in here. I'm just going to pick through and pull out what we got. Some gloves. Once again, sterilization. You know, you might not want to be getting people's blood all over your hands. You might not want to be getting your hands all up in people's blood. We have a nice roll of gauze. This is a 2-inch, but it's 4.5 yards, enough to wrap something up pretty nicely. Comes to wrapping stuff, I keep a roll of medical grade tape and a roll of electric tape. I'm an electrician, and it's an electrician's band-aid right there. Let's see. We have a 2x4 sterile gauze pad in here. So some assorted safety pins, everything. I try to keep it all in Ziplocs and whatnot, just in case this thing takes a bath in the river or something. Just a bunch of you know, gauze pads, different sizes. Never know, you're gonna have to cover a cut or a bruise or a sting. Small pair of scissors in here. Just might have to cut some clothes off of a wound, or, you know, cut stitches. Comes in handy. Little bit of a tent cord. This stuff come in handy. Like I said, just like the paracord, if you need to tie a tourniquet off, maybe slinging something, you know, stretcher construction. In my first aid kit, I also keep a needle and thread for my clothes. I'm not gonna sew myself up with this. I do have some sutures for any stitches of the flesh that might need to take place. But yeah, just a little clothes repair and some seam sealer. You know, your poncho, your tent, your tarp, whatever it might be, starts leaking. Just kind of first aid for the body and for the clothes and the shelter. It's a kind of a convenient place to keep them. This is a prescription item, but it's a painkiller patch. Had an injury, and that was just a leftover. I try not to use that stuff too much, try not to depend on it, but that was left over from the injury, and thought it'd go nicely in here. I also have, it's all taped up to keep the sharp edges away, you know, keep you safe from the sharp edges, but just a simple old razor blade. You know, it's not exactly a scalpel, but could come in handy. This one on the other side, we have another Ziploc bag. Like I said, I'm a big believer in the Ziplocs. We have just random, you know, we got some smelling salts, a few things of burn creams. That's one of your main ones. I go through a lot of burn cream around the campfire. That's a couple of non-aspirin pain relief tablets, a couple of aspirin pain relief tablets. Some Blistex. Let's see, a little bit of antibiotic ointment. Want to keep things clean. Some alcohol prep pads. Prep cleaning type stuff. BZK, iodine prep. Here we have a lancet. For those of you that don't know what that is, you don't need to play with it. But that could be a lifesaver. That's for poison ivy, poison oak. I'm actually fortunate enough that I'm not allergic to poison ivy. It's always my duty to clear it out of camp. But for my buddies that do get it, I got it in the pack. A little sting relief for yellow jackets, bees, whatnot. Another quick clean pad. Those are just a mess of stuff that'll come in handy. This is just a small bottle. You can see I've used a bit of it, but it's isopropyl alcohol, cleaning wounds and instruments and whatnot. A lighter. This always come in handy. A small pair of tweezers. And that is the contents of my first aid kit. Remember, that's equivalent of a first responder. When it comes to treatment, we have a military spec field surgery kit. I'm by no means a doctor nor surgeon. Keep this thing wrapped up. A little paracord, tourniquets, whatever you might need it for. A bandana. I'm a big believer in those. Like I said, they come in handy for all sorts of things. But this thing's not very big. It's I guess this is what the field medics would dig a bullet out of you in the field. Comes pretty well stocked, so you can see there. It's all in this little molly case. There's scalpels, hemostats, forceps. There's a little pen light. Everything and anything that you're gonna need, I would imagine. Let's see. We have contents. This thing contains a pair of straight hemostats, a pair of curved, scissors, tweezers, 2 scalpel blades, and a handle. A set of sutures, a needle probe, some alcohol and BZK wipes, small LED pen light. This thing, like I said, stitch you up, clean you out. Something. Hopefully, you don't need to get into the scalpels and whatnot. But hopefully, this kit is one that I'm not gonna have to break out. This is on the gun principle. I'd much rather have it and not need it than need it and not have it. If something were to happen in a disaster situation, or even on just a hiking trip, medical aid is not available. Sometimes in life you have to do what you have to do, and I think this thing could save a life. Anyway, that's the gear for it. The best piece of gear you can have, though, when it comes to first aid is the training. I said I've taken 3, 4, probably 5 courses altogether in different aspects of disaster survival, first responder, CPR, first aid. Going back to high school until now, over the years, I keep it. The techniques change. It's good to brush up on that stuff, and of course, there's a wealth of information about that on YouTube, anywhere. Just go to Google, search first aid techniques, because really the mind is what you're going to be using. That's your tool. The ability to keep calm and assess the situation and know what needs to be done, and to have the equipment to do it could save someone's life out there in the field. Well, that's your first aid video, CreekWater Cook style. Y'all like, share, and subscribe for me. I'll catch you guys on the trail. Until next time, CreekWater Cody over and out.